Hello and welcome to the Integrative Health Convention 2018 online interviews. Today we're going to find out more about the life energy management approach to health creation mentorship with Dr. Rosy Daniel, who's speaking at the Integrative Health Convention this October. The Integrative Health Convention is an annual convention in London featuring many leaders in their fields of complementary and conventional medical therapies to help people get better through these various healing practices. It's an opportunity for doctors, therapists to meet, share, learn from, and connect with each other. We believe that true health is holistic and that people get better in more than just one way. We believe that we all have so much to learn from each other, and that the Integrative Health Convention provides a stage for this for therapists, for doctors, and the public. There are a limited number of tickets available, which can be purchased at integrativehealthconvention.co.uk. This series of online interviews will help you get to know our speakers better, who are leaders in their different fields of healing, therapy, or medicine, and maybe help you decide which talk to attend out of the 36 talks to choose from over 2 days at the Integrative Health Convention 2018. I'm your host, Dr. To Wong, and I've been a GP for the last 12 years in Devon. I'm co-founder of Neurolinguistic Healthcare Limited, the organizers of the Integrative Health Convention. Neurolinguistic Healthcare Limited offers courses in advanced communication skills and therapeutic techniques, as well as training in hypnosis. Today, I'm speaking to one of our excellent speakers who's coming to the 2018 Integrative Health Convention at the Park Plaza Victoria in London this 13th and 14th of October to share with you what she knows and to tell us a little bit about who she is and what she does and what to expect from her talk at the convention. So this is Dr. Rosy Daniel. Hi, Rosy.
Hello, To.
She's the medical director of Health Creation and also the health and well-being charity, which provides postgraduate CPD courses for healthcare professionals in integrative medicine. They run courses in Bath and online, which help people and therapists to become a holistic health coach with health creation and to gain CPD credits through online programs. And we were just saying how so many things are going online these days, and it's so important. And she can be found at www.healthcreation.co.uk, and I'll put the contact details in the description below. Great. Hi, Rosy.
Hi, To.
Thanks for joining us.
Yeah, thank you very much.
Shall we begin by letting our audience know a little bit more about yourself and what I didn't cover?
Thank you, To. Yes, and thank you very much for this wonderful invitation to come and meet everybody at the Integrative Health Convention. So I'm a GP by background. I trained in Bristol, and but the thing that really caught my attention was the work of the Bristol Cancer Help Centre, which is now called Pennybron UK, which was and is the absolutely most stunning example of true integrative medicine. I got to work in a holistic team with myself, holistic nurses, transpersonal counselors, spiritual healers, nutritionists, energy medicine therapists, group therapists, as people went on a week-long course to understand the messages of illness and to find the transformational potential in their cancer.
Well, that's amazing. And what do you do now?
Well, after 15 years of being there, because I joined in 85 and I left there at the time of the millennium, because it became clear to me that these amazing health shifts that people were going through and life shifts and spiritual evolution, why would we have to wait to get cancer to go through such an amazing awakening and life enhancement? So at the time of the millennium, I threw myself down a massive gauntlet to see, can we roll this all back down the river and get people engaged in the regeneration of their health and well-being before they get ill. So that approach is called Health Creation, and it's become a health coaching and workplace health consultancy organization. So what I do now is I train people in this methodology of health coaching, but in a very holistic way, where people are coming to look at their relationship with themselves primarily, also looking at their state in body, mind, spirit, and environment, and then going on deeper into the real nitty-gritty question of authenticity and finding out who they are what their life journey is all about, what's the meaning, what's the purpose, but with the end result that we help people become really true to themselves. And that whole phase of the coaching is called health revival. The second phase is then the life revival. Okay, so now I'm strong with high life energy. How do I take that forward to truly express myself in a lifestyle and a work style that gives me energy? And because this is all centered around the question of our life energy, I've started calling it life energy management, because in my study of all the complementary approaches, there seems to be one unifying factor, which is the state of our life energy, whether it's high or low, whether it's in balance or out of balance. And many of us have what I call health defining behaviors, which are depleting our life energy, and need to tap into the source of those beliefs and behaviors and lifestyles which enhance our life energy. So there's a tool that I've created called the Picture of Health, and this is a mapping tool for people to see where they're gaining and where they're losing life energy, where they're currently strong and where they're vulnerable. And through the dialogue with the coach, which is very loving, supportive, and empowering, people are enabled to find out what healthy changes they can make to enhance their happiness, their life energy, and move on through with that crucial motivational support and guidance into far happier ways of living and being.
Excellent. Rosy, I'm always curious what brings someone to be interested in what they end up doing in health and healing. Can you tell me how you got interested in what you do, and
Absolutely.
maybe the story behind how you got started?
Back in my teens, I was trying really hard not to be a doctor, because I had a mother, father, brother, grandfather, aunts, 2 uncles that were all GPs. So I wanted to do almost anything else at that point. But my best friend had a severe irritable bowel, and was very ill with it. But I noticed the way that it was ebbing and flowing with her state of mind. When she was anxious and frightened, it seemed to flare up. And when she was happy and in love and contented, it calmed down. So back then, we're talking about the 70s now, I was witnessing the mind-body connection in my beloved friend. And that took me on a journey to try and understand the mind-body connection, which I actually spoke to a very eminent acupuncturist, Dr. Shyam Balasingham, at the time, and asked him to take me on as an apprentice, because acupuncture seemed to be the only thing then I could find that was talking about the mentals and the effects of the mind in all of the health and well-being. But actually, he said, go back and learn Science O and A levels. And I followed his advice, and my director in my college at that time said, you can't waste a brain like yours on that integrative medicine rubbish, acupuncture rubbish. And I didn't agree with him, but I did feel that is how people think, and it would be best to be a doctor, to be a bridge between these worlds of orthodox and complementary medicine.
So, Rosy, we're going to talk about the life energy management approach in health creation in October at the Park Plaza. Can you tell us all a little bit more about this and what the audience will gain out of it?
Okay, so the idea of this talk about life energy management is to explain the model, the concept, the tools, to give you case studies of how this has worked. And the point of the Picture of Health tool is that you might get people coming to you with the same complaint of perhaps low energy or feeling bad, but the causative factor might be different, and so I'll be showing some case studies of different people who came to me feeling tired all the time. This is a condition that shows up in GP surgeries apparently 47% of people say in this day and age, I feel tired all the time. But the tool helps you to see what the cause is, and it's a very different, for the case studies I'm going to share with you, it's a very different causative factor, requiring very different management and very different advice. But I'll go on and show you the results that we've had with individuals, with schools, with healthcare bodies, and also after the conference, give people the chance to do this picture of tool assessment for themselves, so that, because one of the other things I'm very, very keen on is to get healthcare professionals walking our talk and looking at these things for ourselves, because quite often we project out onto others. We're busily helping other people and saving the world and so forth, but pretty hopeless at walking our talk. So I want very much to encourage practitioners to get involved in looking at what's going on with them, their own life energy, and because I think we can have a big tendency to overgiving, draining ourselves, and going into burnout if we don't really work out how to resource ourselves. Afterwards as well, there's a possibility for people to train with me either online. I've created a module called the Principles and Evidence for Health and Wellbeing. I've divided the territory up into 12 domains, and I've explained in the online course, which is accessible through Health Creation, exactly how I know what I know in each of those domains, the history of the evolution of that knowledge, and critically the science that's come in this very exciting. When we started at the Cancer Help Centre, it was based on intuition. And now we have the stunning evidence coming through from psychoneuroimmunology and epigenetics and nutrition and spiritual healing to show us just how right those founders were at the Bristol Cancer Help Centre. So there's a training online, and there's also a training in person, which is a mentor skills training. But the difference from other health coaching trainings around is that this is very holistic, and it enables people to take people on a really profound journey to understand their drivers, their limiting beliefs, and their authentic soul expression that they're looking for in this life.
Wonderful. My next question is, having thought about the Integrative Health Convention, where the audience will be made up of doctors, therapists, and the public, where do you see health creation fitting in with integrative health?
Well, I think the big shift I made, To, is from helping people on an illness journey into a wellness journey. And with the escalating lifestyle health problems and the aging population, there's going to be a crisis in the NHS in terms of our ability to keep funding and looking after people who are going through their lifestyles into degenerative illness of one sort or another. And what's been proven by my peers, Dr. Dean Ornish in the States and many other good researchers, is that simple lifestyle changes can avoid illness and take us into not only have more happiness and fulfillment, but much more sustainable health and independence. So I think the health coaching skills that I teach are needed by all healthcare practitioners, and the model I teach, because this is the key to get people across onto a wellness journey. So whether people dip in and purely do my online health and wellbeing training to really broaden the base of their understanding of the importance of these, all the changes that can go on in body, mind, spirit, and environment. And this is in very fine detail. I've done a lot of research into this, collated a lot of information. Or if people want to learn those skills to bring health coaching into their practice as an existing practitioner, be that a doctor, therapist of any type, the coaching approach is definitely the way forward. And of course, there will be some amongst the audience who say, that is totally what I want to do, lock, stock and smoking barrel, to become a holistic health coach in this health creation methodology, and perhaps go on and become a health creation consultant to take this into the workplace, because we apply the same methodology. All the staff do their picture of health. We collate them, we get a staff picture of health, and from there we coach the staff to create their own health and well-being strategy, and it really starts to bring organizations to life. So this is the relevance of this course. People can apply it to themselves and in their professional lives.
It's wonderful. Rosie, I've got one last question. So as a doctor, therapist, coach, teacher with many years of experience, what do you think in particular is the key to healing in what you do? I'm looking for
I would have to say, of course, that the biggest healer of all is love, self-love, and love of life, and bringing ourselves out of the grey into the bright, vivid, colourful joy in living. There are many things that get us there, and for myself, my health and well-being has come through a lifelong practice of yoga, through dedicated practice of asana, pranayama, meditation, learning to be comfortably in my own skin, and nature. I garden, I walk, I spend time in the beauty of nature. But actually at the core of the work I've done all this time has been spiritual healing and energy medicine. I'm proud to be patron of the Healing Trust, formerly National Federation of Spiritual Healing, and also patron of the British Wheel of Yoga, because as I've said, yoga has been a lifelong practice, but with the Healing Trust, I have profound respect for the healers who are the unsung heroes and heroines who, behind all the work I've done my whole career with people with cancer, the healers have provided the love, and the energy support to get people who have become entirely flattened or grounded through their lives, or disappointment, heartbreak, people who have crashed with their energy, and maybe know what would make a difference, but just are too low in energy to get themselves up that energy ladder. So really, the spiritual healing can be that first step that brings people into a state of energy where self-help becomes possible. So, I take my hat off to the spiritual healers, the Reiki practitioners, the Jo-Ray practitioners, all those people who are providing that first lifting with love, light, and healing energy to get people to a point where they can make that sustainable.
That's great. Thank you, Rosie. Thanks for your time.
My great pleasure. See you at the convention.
See you then. Thanks, everyone, for taking the time to listen and to choose to listen to this one from all the other interviews out there. So remember to get your tickets early now from our website. We are the Integrative Health Convention in London on the 13th and 14th of October 2018. As a gift, you can use the discount code podcast10, which will give you a 10% discount from us to you for sharing your time with us. When we see you in October in London, you'll get to meet Rosie, myself, and all these amazing speakers, and learn so much more then. So we look forward to seeing you there. Thank you.